I was born in Florida, raised here in Dixon, raised here at Horizon Medical Center, which was called Good Lark. My grandfather was Dr. William Jackson. He was one of the three brothers that envisioned this hospital. And when I say I was raised here, my grandfather would bring me in for rounds when I was 5 years old, and I would get to work in the switchboard. And I've just grown up around medicine. And so he planted the seed very early on in my life that if I wanted to be a professional, if I wanted to be a mother, if I wanted to be a wife, all of the things, I wouldn't be able to do that as a physician. It would have to be as a nurse practitioner. There's not a lot of specialties in medicine where a patient can come to you with a problem and you have very hard and fast solutions to get them feeling like they were before their problems started. We can provide stress testing, we can provide arteriograms, we can provide cardiac rehab. So for the vast majority of issues that patients are faced with from a heart perspective, this is a wonderful place to start. And if we can provide our service at home, that is where our patients want to be. As a cardiology nurse practitioner, I am just one very small piece of a very large puzzle when it comes to cardiology. With my years of experience, I'll see consultations, so patients will be referred to my practice with a chief complaint of chest pain, of heart palpitations, of just basically feeling unwell. And then it is my responsibility to just start to peel back the onion to see, with all of the testing that we have available within our department, what am I finding? Am I finding a plumbing problem? Am I finding an electrical problem? Or am I finding a structural problem? And once we figure out what those problems are, I have access to the best physician colleagues, not only here at Horizon, but also at Centennial Medical Center, to say, we found your problem, we have a solution, this is where I take a step back, my physician colleagues come in, provide whatever service is needed in a timely fashion, and then it's my job to keep them away from all hospitals and all cardiologists in the future. A moment that definitely confirmed that cardiology was where I belonged in my professional world, as well as my personal world. I had a dear friend whose mother had a heart attack, and it was initially missed. And unfortunately, because it was missed, she ended up having a heart transplant 2 weeks later. And just watching that entire team wrap their arms around her and give her years back that she never would have gotten was the solidifying time for me to say cardiology is where you want to be. What I want the patients that I serve to take away from our time together is I want them to realize and to feel not only the love and the commitment, but also the 24-hour care and commitment that they can expect from me and my practice. I don't just say this because the words sound good. I love pouring back into the community that gave me an opportunity and that gave me a shot. And if I can positively impact one patient, then I've done a great job today. My name is Jennifer Law. I'm a nurse practitioner, and I practice at Centennial Heart at Horizon.